So now I would like to introduce Jonathan Greenberg. He is assistant professor at Harvard Medical School and research staff psychologist at the Integrated Brain Health and Research Project at Mass General. Dr. Greenberg, welcome.
Hi, thank you so much for having me. It's a pleasure seeing you again and pleasure being part of this conference. And thanks for the introduction. Yeah, so I've been involved with mindfulness practice personally for about 20 years, and I've had the pleasure of researching it academically for the past 13 to 14 years. And I'm going to talk today a little bit about how mindfulness can affect brain structure, how it can affect how we think and cognitive processes, and I'm going to relate it to how we can manage chronic pain. So let me see if I can share my screen here. There we go. I'll put this in presenter's view. Here we go. So hopefully you're able to see my slides. So I'll start off with disclosures, which I don't have any, so there's no conflict of interest to declare. And I'll give a little bit of an outline of my talk. So I'm going to give a very brief background on what mindfulness is. Then I'm going to talk a little bit about some findings from the research on mindfulness and brain structure. Then I'm going to have a little bit of a taste of the effects of mindfulness on cognition. Just a couple of studies I'm going to highlight. And I'm going to kind of wrap up with some findings about mindfulness and chronic or facial pain outcomes from the Facial Pain Association. So I'm very excited to share with you that as well. So what is mindfulness? So mindfulness has evolved from the Pali word sati. Sati means to remember or to bear in mind, keeping the mind alert to the phenomena that affect the body and mind. That's kind of like the more Buddhist definition of what sati is. The Western definition or translation of that has been mindfulness. And the most widely cited definition has been conceptualized by Jon Kabat-Zinn. He's a biologist that spent a bunch of time in monasteries in Asia. And he really he secularized it, and he really formed these programs that we have today. So he defined it as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So the key concepts here are attention to the present moment and this non-judgmental component. So we're paying attention to what's happening now. We're trying to be open, curious, and not impose, this shouldn't be like that. I want it to be differently. Okay, this is how it is, and I'm open to it. There are all sorts of definitions of mindfulness. What I give to you there, it was the most widely cited one. Mindfulness has also been suggested to be composed of 5 different facets. The first is observing, so just like noticing whatever is happening right now. Describing it, so putting it into words. The third one is acting with awareness, so that when you do things while paying attention, right? So if we we're having our breakfast and we're watching TV and there's food in our bowl and then the food is gone and we have no idea where it went because we're watching TV, we're not acting with awareness. So paying attention to whatever is happening while we're doing things is the acting with awareness component. There's also non-judgment, non-judging of inner experiences, and non-reactivity to inner experience. So that's another way to conceptualize mindfulness as being composed of these 5 different facets. And I will return to those later on when I talk about some of the findings with regards to chronic orofacial pain. So over the past decades, since I think the late 70s and early 80s, there have been developed a few associated programs and therapies that either are based on mindfulness or they have mindfulness as a component. The most widely studied one and most widely available one is MBSR, mindfulness-based stress reduction, developed by Jon Kabat-Zinn in the late 70s. It was the first clinical population to undergo this is patients with chronic pain. So this program was developed with helping chronic pain in mind. In kind of like the later 90s, there was kind of like a spin-off of MBSR, which is called mindfulness-based cognitive therapy, which is primarily aimed at people who have recurrent depression, aimed at preventing a depressive relapse. So it's kind of a combination between cognitive therapy and mindfulness-based stress reduction. And then there are mindfulness-informed, not mindfulness-based. There are therapies that have mindfulness as a component, such as dialectical behavior therapy and acceptance and commitment therapy. So mindfulness is pretty widespread these days, and it finds its ways into many therapies. A lot of people, if they go to standard cognitive behavioral therapy, which is the gold standard for psychological interventions, mindfulness today is under the umbrella of that as well. So if you go to CBT, if you go to cognitive behavioral therapy, you might receive mindfulness techniques. I have a daughter, she's 7. She came home and she's like, "Hey, look, Daddy," and they're teaching her mindfulness in school. And I'm like, "Oh my God, this is amazing." So we started doing meditation before she goes to bed, which has been helpful, particularly with all the COVID and anxiety and all that stuff. All right, so that was a very brief introduction on what mindfulness is and how it kind of found its way into practice and clinical work today. And I'd like to share with you a few of the findings on mindfulness and brain structure. So one of the earlier studies involving MRI and mindfulness specifically was conducted by Dr. Sarah Lazar. I was fortunate enough to have her as my former mentor. And it's a study investigating mindfulness and cortical thickness. And basically, this study compared people who are long-term meditators with a control group that was matched in terms of age and demographics, but they did not practice mindfulness regularly and they did not have mindfulness experience. And one of the main areas in which the brain differed between the mindfulness and the non-mindfulness practitioners is this area over here. I hope you can see my cursor. This is the anterior insula. So anterior insula is an area of the brain that has to do with body awareness, interoceptive awareness, our perceptions of our body. Okay, and it's not very surprising because a lot of what we do, a lot of what is common to do in mindfulness programs and mindfulness practice is paying attention to our breath, paying attention to the sensations of our body. And whenever our mind wanders, we kind of bring it back to what our body is feeling. So given that emphasis in the practice, it's interesting to see that people who practice mindfulness a lot actually have thicker cortices in the area or an area that's associated with interoceptive awareness and body awareness. So that's anterior insula. Another area that was found to be thicker among people who practice meditation is this front spot right over here. It's Brodmann area 9 and 10. It's an area that's very important for working memory and executive decision making and kind of higher cognitive functioning. It's an area that usually gets thinner as we get older. And so it was interesting to see, if you see the blue people, the blue dots, these are the people that were practicing mindfulness. So we see a straight line here. On the y-axis is cortical thickness, and on the x-axis is the age. So what we typically see, if you look at the red spots are the control group. This is what we typically see in people. So as they get older, these frontal regions tend to get thinner. This is even part of normal aging. Interestingly, in the mindfulness group, the line is pretty much flat. So people who are 50 years old have the same cortical thickness in these frontal regions as a person that's 25 or 30 years old, which is a very interesting finding. We have to keep in mind, though, that this is just a comparison of one group and the other. There's no intervention here. Okay, so you may say, well, maybe the people who are practicing mindfulness, maybe they eat better and maybe they sleep better, or maybe they're all, I don't know, maybe they're all vegetarian, maybe they all live hippie lifestyles. There can be many differences in these people that are not maybe only mindfulness, and that's very legitimate. So that's why we need studies that actually test people before and after mindfulness practice, which is exactly what the same group did a few years later. So basically, they tested a bunch of people before and well, there was two groups. There was a mindfulness group and there was a waitlist control group, right? And people went through MRI, a structural MRI, before and after the mindfulness training. And the control group went through 2 scans without anything in the middle. And they actually found increases in gray matter thickness in several brain areas in the meditation group. The first area is what's called the TPJ, the temporal-parietal junction. It's kind of the bit over here where the temporal junction meets with the temporal lobe meets the parietal lobe. And this is an area that's associated with things like empathy, compassion, theory of mind, and switching perspectives. So if you look at things through different perspectives, if you kind of look at things in a different way, so this area in the temporal parietal junction is activated. And so we saw that people in the MBSR group, the mindfulness-based stress reduction, had higher gray matter density in this area. Another area in which they found differences following mindfulness training is this area over here, which is called the PCC, the posterior cingulate cortex. This is an area of the brain that has a lot to do with self-related processing, the stuff that's me and mine. This area gets activated. It also has a lot to do with mind wandering and concentration. And again, it's interesting to see because mindfulness has such a heavy emphasis on attention and regulation of attention. And every time your mind wanders, you bring it back. And then it wanders again, then you bring it back and you try to be open and non-judgmental towards your experiences. So it was interesting to see that this area, this PCC area, which has a lot to do with concentration and mind wandering, actually increases in gray matter density following mindfulness-based stress reduction compared to control group. And another area that was found to be affected by mindfulness training is the hippocampus. So the hippocampus is an area of the brain that has a lot to do with learning. It's very sensitive, and interestingly, it's very sensitive to stress. So among populations that have high stress load, the hippocampus tends to shrink. So people who have depression usually have smaller hippocampus. People who have post-traumatic stress disorder usually have smaller hippocampus. Even people who have chronic pain, some findings indicate that they have a smaller hippocampus. The hippocampus also shrinks a lot of the time as we get older. And so it's interesting to see that following mindfulness training, the hippocampus can actually grow, or they could be like at least the gray matter density in that area can increase, which shows a lot of promise, presumably, with regards to treating many clinical populations who suffer from stress and anxiety and pain. This is another study that's not yet published. We're kind of working on it. This is a study that involved meditation. It has mindfulness as a component, but it was not strictly mindfulness meditation. It's called the Stress Response and Resiliency Program. It's a meditation program that has mindfulness, but not strictly mindfulness. And so people underwent this 8-week meditation group, and there was also a control group who underwent stress education. So just like information and education about stress. And what we found was both the left hippocampus and right hippocampus, we found greater change in the meditation group compared to the control group. And interestingly, these changes in the hippocampus, they actually correlated with reductions in perceived stress. So the more the hippocampus grew following mindfulness training, the less stressed people became. And so it's one thing to see just a change in the brain, but then people ask, so what does that mean? So it's, in my opinion, it's extra interesting to see that, oh, you know what? There's a change in the brain, but it's not just a change in the brain. That change in the brain actually associates with an actual felt clinical improvement in how people feel, and in this example, stress reduction. This is meta-analyses of structural brain changes following mindfulness practice. Actually, it's following meditation practice. They included mindfulness here, but they also included other types of meditation like Zen meditation and other forms as well. And so we saw this review indicates that several brain regions are changed following meditation practice. The first one is the rosterolateral prefrontal cortex. That's an area that's associated with meta-awareness, like being aware, thinking about thinking, which is a lot of what we do in mindfulness practice, right? If I'm meditating and then I'm noticing something, then I'm saying to myself, oh, I'm noticing myself becoming agitated. I'm noticing myself becoming restless. So this is a kind of a meta-awareness. And it's interesting to see that's an area that is associated with meta-awareness in the brain actually can change following meditation. This is our dear friend, the insula, right? We talked about that before. That's the area of the brain that has a lot to do with body awareness and interoceptive awareness. So it's nice to see that it's not that one study that I showed you. Actually, the meta-analysis of quite a few studies showed changes in the insula following meditation. ACC, the anterior cingulate cortex, that's an area of the brain that's associated with self-control, self-regulation, including pain regulation. So when we experience pain, that ACC usually fires up. And so it's interesting to see that following mindfulness training, this area is affected in terms of brain structure. And our dear friend by now, the hippocampus. So it's relatively established now that meditation can affect the hippocampus. And as we said, it's an area of the brain that's associated with memory consolidation, but also it's very sensitive to stress and aging and depression. So yeah, so if we were to summarize this part, we see that meditation is associated with brain structures that have to do with body awareness, mind wandering, meta-awareness, self-regulation, perspective switching and empathy, and memory and stress. And there's quite a bit of evidence from questionnaires and stuff like that, that people report these aspects in their lives changing, but it's interesting to see that we see similar changes in the brain areas that are associated with these factors. All right, so that pretty much sums up this second part that about meditation and brain structure. And now we'll move on to talk a little bit about cognitive function. And again, this will just be a little taste of the literature. There's a lot of literature here. I'll try to kind of pick some available studies, including some of my own. First area I'd like to talk about with regards to mindfulness and cognitive functioning is cognitive rigidity. So cognitive rigidity is when we kind of learn something and we stick to it. We cling to it. And even when it's kind of time to change or it's more adaptive or better for us to kind of think of things in a different way, we kind of stick to what we know, hell or high water, and we just perseverate. Okay, so this is a lot of time what we mean when we talk about cognitive rigidity. And it's common in many health conditions and mental health conditions. Cognitive rigidity is relatively common among people who have anxiety and people who have depression, and even people who have chronic pain, probably due to the mental stress that goes along with it, which is by this time relatively well established. So I was looking for a way to test cognitive rigidity and see if mindfulness can actually impact cognitive rigidity. So I was looking at different ways of kind of tapping into that. And I found this water jar task that was developed in the early 1940s. It's called the Einstein water jar task or water jug task. And it's kind of mathematical a little bit, but I really liked it because I think it really taps into that aspect of cognitive rigidity. Let me tell you a little bit about how this task works. So I sit participants in front of a computer and they have these three jugs, jug A, B, and C, right? And each jug has a different amount of liters, 21, 127, and 3. And people have to kind of add and subtract. They have to play around with these three jugs until they reach a target amount, which in this case is 100. So I'll spare you the agony of figuring this out. The solution is B minus A minus 2C's. So B is 127, minus A is 106, minus 3 is 100. So B minus A minus 2C's is the solution. So they reach the solution, hopefully. Usually they do. And then they're presented with another problem, and the numbers change. But the solution stays exactly the same. So B minus A minus 2C's gets you to the target. B minus A, 43 minus 18 is 25, minus 10 is 5. So B minus A minus 2C's. And then they do another problem, and another problem, and another problem. And over again, the solution is exactly the same. B minus A minus 2Cs, B minus A minus 2Cs. The idea is to get them into a habit, into a mental set, right? So they know how to solve it, right? I'm actually kind of training them to think in a certain way that is rather complex. B minus A minus 2Cs is not a very easy solution. Now, the trick is, eventually, they get to a problem that can be solved in the regular way. B minus A minus 2Cs will get you to 22. But there is a much easier way to solve this. Can you see it? I'll give you 3 seconds. All right. So what we see is that actually 22 can also be solved by 18 plus 4. That is so easy, so simple. My 8-year-old and possibly my 6-year-old could solve this. He probably couldn't, but she can. The 8-year-old could. So this is something that's very easy to solve. But what we see is in many people, because they were trained to think in this way, because they got into this mental set and they kind of cling to it, this cognitive rigidity, right? They learned a complex way to solve a problem and they cling to it. And even if there's something that's really, really easy, they miss out. They're blinded by their own experience, right? They're rigidly clinging to something that's no longer adaptive. In the instructions, I blatantly say, use the simplest solution possible. So, and what we see again is that people, they cling to what they know and they miss out on something that's a lot more adaptive. And then further, eventually they get to this new problem that can no longer be solved in the long and complex way. B minus A minus 2Cs will not get you to the answer here. What will get you to the answer? The simple solution of A plus C. Super easy. But because I train people to think in a complex way, a lot of times they don't see that. And sometimes I wait 5 minutes, 10 minutes, and these participants will knock on my door and they will say, oh, Jonathan, this is one of these trick questions, right? You want to see how long it takes me to give up? There's no real solution to this. And I'm like, dude, give it a few more minutes. And it was really amazing to see how rigidly people cling to what they have learned and how difficult it is for them to think in a different way, even when it's something that's so simple. So getting to the mindfulness, what we did was the first study we did with this is that I compared people who were experienced meditators, who had a lot of mindfulness experience, compared to people who had no mindfulness experience, but they already registered to their first meditation retreat. Because I did a bunch of meditation retreats, they let me go to the retreat before the retreat started, and I got there early, and I said, hey, there's a study here. Do you want to do it a few minutes on the computer? And what we saw is that the people that were experienced meditators were less rigid. So the y-axis rigidity score, less is better, less is less rigid. So we see that the experienced meditators were less rigid than the control group. But again, these are two different people. What we really want to do is have a mindfulness intervention and see if people change, right? So what we do is we actually had this 6-week of mindfulness training, and then we had a waitlist control group. And what we saw was that after the mindfulness training, the mindfulness group was significantly less rigid on this water jar task compared to the control group. Now, this is a related finding, but from another study. This is for people who have depression. And this is not the water jar task. It's a self-reported questionnaire of cognitive flexibility, which is basically the other side of the coin of cognitive rigidity. And MBCT is mindfulness-based cognitive therapy. What we see is that the people who underwent mindfulness training, they're in the darker gray. Here, higher is better. Higher is more flexible. We see that these people actually improved in their cognitive flexibility by self-report compared to the waitlist control group, who actually did not change. They showed a trend of decreasing, but it was not significant. So that's another piece of evidence that mindfulness may improve cognitive rigidity. And that has quite a few implications to pain management. And I will save these to after I present a little bit about the next cognitive function. So this is piece number 1, mindfulness improves cognitive rigidity. Another facet of cognition that may be influenced by mindfulness is proactive interference. Let me explain to you what that is. So proactive interference basically is when past memories or old information that we already know interferes with retaining newer material, something new. So it's when the past interferes with the present, when old stuff that we already know interferes with retaining newer material. Now, I don't know how it is where you guys are, but in my place of work, every maybe 3 months, we have to change the password. And for me, it's very annoying because every time after I change my password for like 2 weeks, I keep entering my old password, right? That's proactive interference. That's the old information, right? This old memory of my old password interfering with retaining the newer material saying, hey, buddy, this is updated, right? It's no longer your password anymore. It's time to learn something new. But this old password kind of interferes, right? Also, it's 2022, right? Happy New Year. This is January now. I don't know about you. When I write the date, sometimes I still write 2021, right? That's proactive interference. That's the old memories, the old information interfering with retaining the newer material of it's a new year now. So proactive interference, it's also associated with the hippocampus. It's a cognitive function. It's a brain area that's affected by mindfulness practice. Proactive interference is very important for higher cognitive functioning, and it's like the past interfering with the present. And so we wanted to know, if you practice mindfulness, can it reduce proactive interference? Because there's this whole emphasis of being in the present moment and not being subject to all the baggage that you bring with you from the past. If you really attend what's happening now, maybe it can reduce proactive interference. We also hypothesize that mindfulness will increase hippocampus volume, which is similar to kind of the findings that I showed you before from older studies. And we also thought that, okay, if proactive interference has to do with the hippocampus, maybe there'll be a correlation there. Maybe the more people improve, the larger the hippocampus will become. I'll try not to spend a lot of time on this because this is a bit of a technical slide. This is basically the task of how we typically measure proactive interference. Super briefly, all right, so people see a bunch of letters and then they see a single letter and they just have to say, did this letter appear in the list that you just saw or not? Here, the letter J appears here, so the answer is yes. And then they see another set of letters. And then let's say that they see the letter W. W does not appear in the last list, so the answer is no. But because W appeared in the list before, a lot of times people say yes, because the old information from the previous list interferes with retaining the newer information from the last list that they saw. So this is the old information interfering with the new, which is what proactive interference is. So we basically randomized people, I think we did 75, I think it was people, we randomized them to either a mindfulness group or our control group of creative writing. And what we saw was that after mindfulness training, people's scores on this proactive interference, while controlling for baseline scores, were lower. So lower is better because it's less errors, it means less proactive interference. So people undergoing mindfulness training had less proactive interference after training compared to the control group. And not only that, but the more people improved, the x-axis is how much they improved in proactive interference. The y-axis is the change in the left hippocampus. What we saw is that there's a significant correlation in the mindfulness group, so that the more they improved in proactive interference, the larger the hippocampus became. Of note, we did not see significant changes in the hippocampus overall when you just compare hippocampus with this group compared to that group, possibly because it was only a 4-week mindfulness intervention and not like an 8-week one. That's more common. So we saw that mindfulness actually can reduce proactive interference. And we saw that the more people improve, the bigger the hippocampus became. So we see that mindfulness can help us learn new material. It can help reduce interference of old material. And these improvements are actually associated with hippocampus growth. Now, there's a lot of other cognitive research out there with regards to mindfulness. I can't review it all. Very briefly, I can say that overall, we also see changes in working memory following mindfulness training. There's also some findings on executive function, like working memory updating, inhibition, switching between tasks. A lot of these differences are primarily found in non-clinical populations and also people like 60 and above. So these are the populations that tend to improve the most in these cognitive functions. So if I were to kind of put this together in the context of chronic pain and kind of overcoming adversity in general, a lot of the difficulty that people have with pain, but not only with pain, is this need to unlearn patterns of responses. So maybe initially we had that surgery, or we have that there was this kind of pain, that like the onset of the disease, if you have trigeminal neuralgia, or if you have something else, it's like, all right, so there's the initial pain, and then you react to it in a certain way. And maybe initially this reaction is adaptive and it's helpful. But once the pain becomes chronic, a lot of the times these initial reactions, they're no longer helpful. So a lot of times if I have chronic pain, and so, okay, maybe the initial reaction, okay, let me limit my life, let me limit my social interactions, let me kind of, all right, I won't engage in my hobbies anymore, I won't engage in physical activity anymore because I need to deal with this pain. But you know what? I had pain for 6 months, 3 years, 5 years, 10 years. If I live in this narrow world, it impacts my life a whole bunch. And so a lot of the work that I need to do is unlearn these responses, unlearn these habitual tendencies, unlearn these rigid patterns that I have formed. And this is true for psychotherapy in general. A lot of times, I'm a psychologist, people come to a psychologist because they learned a certain pattern that's no longer adaptive, and it's giving them a hard time in their lives today. And a lot of the work that we do in psychotherapy is trying to learn something new and say, hey, buddy, you're right. This horrible thing happened to you when you were 10, but you're 48 now. Okay, so let's see if there's anything new here that you can actually, maybe you can change your responses or change your relationship with your pain or with anything else that's happening in your life, right? So mindfulness can potentially help us cultivate openness to changing our relationship with pain or with other aspects of adversity in our lives, and maybe learn some new perspectives, and also kind of break what we call the disability spiral. So especially in chronic pain, there's like this spiral of disability that, we have a lot of pain, so we limit our activity, and then our muscles become kind of weaker, and there's physical deconditioning, and then we become, more depressed and more anxious because we do less and we're less engaged in the things that actually bring us joy. And then the less we do, the more disability we have, the more pain. So it's like more pain, more physical deconditioning, emotions get worse, more pain. And it's a cycle that you need to break from. And in order to break out from this cycle, you need to be open to new information and to switch your perspective and your relationship with your pain and with the adversity of your life. And potentially, given this evidence with mindfulness reducing cognitive rigidity and mindfulness reducing the past, interference from the past to the present, and make us open to a new way of seeing things, which can potentially help us break away from this spiral of disability. All right, let me check on the time here. All right, so it'll only take a few minutes. So I'll do this, and I'll try to leave time for questions. So this is actually results from a survey from the Facial Pain Association. Thank you so much, Allison, for distributing this survey, and thank you, Facial Pain Association members, for actually completing this survey. We had 303 people that completed the survey. It assessed a bunch of pain-related outcomes and some coping mechanisms. The first thing that we noticed when we looked at this data is the degree of emotional distress that members of the Facial Pain Association are experiencing. So more than half reported clinically meaningful symptoms of anxiety, 2/3 reported clinically meaningful symptoms of depression, over 1/3 are currently taking antidepressants. That really shows how much facial pain, it's more than pain in the face, right? As I don't have to tell you guys that, right? It comes with this emotional burden and toll that can really have a large effect on people's lives. And many of you have been facing this for years and years and years, and it's still an unaddressed problem because look at these rates, they're very high. So what we did is we assessed a bunch of pain-related outcomes like pain intensity, pain-related disability, and anxiety, and depression. One thing that we did is that we wanted to see which facets of mindfulness are associated with these outcomes. If you recall, there are 5 facets of mindfulness. So for pain intensity was associated with non-judging. So the more people were non-judgmental towards their experiences, the lesser the pain intensity. With pain-related disability, we also see non-judgment in addition to acting with awareness. Interestingly, the observing factor was positively correlated with disability. So if you only observe, if you only kind of pay attention to the pain and the bad things, it can actually be associated with more disability. So these are the facets that were associated with all our outcomes. The first thing that stands out is the key role played by non-judging. So non-judging was associated with all these outcomes. So the more you're able to utilize mindfulness or to cultivate a non-judging attitude as much as possible towards the pain, towards the adversity, the better the outcomes can become. And the second takeaway is, like, if you just observe, if you only pay attention to your pain without this component of openness and non-judgment, right? That can, right? If we just kind of laser focus on the bad stuff, it can actually be associated with worse outcomes. But if we do so in a manner that's non-judgmental, that is associated with positive outcomes. Another interesting finding here is that all these outcomes from our sample of people with chronic orofacial pain, they were all pretty heavily associated with pain catastrophizing. Pain catastrophizing is a tendency to kind of magnify the pain. Things like, I feel I can't go on. I feel I can't stand it anymore. I keep thinking about how much the pain hurts, right? And we all do it sometimes, and I'm sure you're familiar with it to some degree. And so the more we engage in it, the worse our pain outcomes are. And mindfulness there's evidence on this, that mindfulness can actually reduce pain catastrophizing. So mindfulness can actually potentially be a vehicle by which pain catastrophizing can reduce and can potentially reduce or improve these pain-related outcomes. All right, wrapping up here, tips and strategies that I typically give just for optimizing coping with pain. If you haven't given mindfulness a try, you got nothing to lose, right? It's free to try. There's countless videos on YouTube. There's books. There's courses. You can inquire with your primary care physician. He can direct you to sources of mindfulness, and if you can integrate it into your life with formal practice where you actually sit and meditate. But also in informal practice, you can just be kind of attentive and open and non-judgmental towards anything that you do in your daily life, whether in the shower, or eating, you're interacting with people. Mindfulness can be practiced anywhere. You can read a bunch of mindfulness books. There's a few resources in the Facial Pain Association website. I provided a few resources that I think are still up there. So there's some books there, there's some resources there. So make use of those if they're helpful. Notice any automatic reactions to pain and stress, particularly the catastrophizing bit, right? If you can bring more attention there, you can quiet that down a bit. That could be associated with improved pain-related outcomes. In conclusion, wrapping up, mindfulness involves paying attention in an open and curious way. We saw that mindfulness can elicit some cognitive and brain changes that can impact our relationship with pain. We talked about brain areas associated with body awareness, mind wandering, meta-awareness, self-regulation, switching perspectives, stress, and memory. And we saw that there are some mindfulness facets that are associated with chronic facial pain outcomes. All right, this is our group. I'd like to thank our group very much, primarily Dr. Franciano, which is the director of our program. I won't be here if it weren't for her and the support from the entire group. And thanking you for your attention and for completing the survey. And thank Allison as well for her assistance and help with all of that. So thank you, and I'm happy to answer any questions if we have any.
Thank you so much, Jonathan. Yes, we have some questions. Before I get to those, I want to mention that Dr. Greenberg did a webinar with us also on mindfulness, and that presentation focused more on the details of what mindfulness is. And I believe you walked us through an exercise. And so I really would encourage you to go to the facial pain website where all of our past webinars are recorded. They're also on our YouTube channel. and to give that a watch. And there are the resources that he mentioned. You can jot those down and take a look at those. With this presentation, we wanted to really talk about, maybe for the skeptics out there, maybe for the people who say, I don't know, this doesn't sound like a real thing, or tell me what the science is behind that. And so Dr. Greenberg and I had a conversation. We decided for this presentation, we wanted to focus on that. And I think for certain, you absolutely did give us all the rationale behind why this is a worthwhile avenue to go down for many people. So thank you for that. Okay, so one question I got was, you talked about being non-judgmental. Can you explain what that is, and maybe, walk through what that thought process might be for someone?
Yeah, that's an excellent question. Comes up pretty often. So basically, it's the general premise is, and it actually stems from Buddhism. So that it has Buddhism has like the Four Noble Truths, and I'll spare you all four of them. But the gist of it is that human suffering is not caused by the circumstances of our lives. It is caused by our resistance to things that are happening, and wanting things that we can't have, and not wanting the things that we do have. And so there's this friction, there's this internal fighting of, why is this happening? I don't want this. I want things to be differently. I shouldn't be doing this. You shouldn't be doing this. This is wrong, right? So all this is our one of the in Pali, in the Buddhist tradition, it's called dukkha, right? It's which translates roughly to suffering, right? So according to that approach, suffering is caused by our resistance to what is, and when we talk about kind of like the Western translation of what the flavor of non-judgment that we're referring to, that would be it, right? So anytime we're kind of thinking, why is this happening? This should be differently. I should be different. You should be different, right? The circumstance, especially when we're kind of lamenting over things we can't control in our lives. If it's over things that we can't control, it can actually be positive, because if it's like, hey, you know what? Here's something that's wrong. Let me fix it. That's awesome. But so much of our life, especially people with orofacial pain, because a lot of times, things like trigeminal neuralgia, in the day-to-day, there's not a whole lot that you can do, right? There's no magic switch that the pain shoots, it's there, right? And so it's very difficult to just, okay, I'm accepting the pain. And that's not really what is needed. But if we can, at least to some degree, lessen our amplification of this pain, and why is this happening, and I can't handle it, like kind of like in the what we talked about when I talked about pain catastrophizing, that can go a long way. So when we talk about non-judgment, just try to be aware of when you keep resisting and fighting things that you can't control. That would be the takeaway.
Okay, wonderful. Thank you. Let's see. You mentioned memory and executive function, and how there's evidence that mindfulness practice can improve those. And I know for many people with facial pain, one issue is that medication tends to affect those areas. So are you kind of saying that the mindfulness training would sort of counteract the effects of that?
So I can't give a blanket statement like that and say, hey, if you do this, the side effects of the medication will poof disappear, right? And we see that especially in clinical samples that are less than 60, sometimes we see these differences, sometimes we don't. But there is some data out there about higher cognitive functioning, decision making, and particularly executive functions. And when we talk about executive functions, a lot of times it's working memory, updating, switching between tasks and mindsets, and inhibition, stuff like that's kind of like higher up. There is some evidence that they can be improved. It's not guaranteed. It's not going to be for everyone. It's not going to be a magic cure for the cognitive issues that many people experience. However, there is evidence it can improve. A lot of times what we see, particularly among pain populations, so even without the medication, right? So the pain itself, it causes a lot of anxiety and a lot of depression, and the anxiety and depression themselves can reduce cognitive function. It impairs concentration, it impairs decision making because we're kind of preoccupied with it, and kind of our mind tends to drift to how it's going to be and how I'm going to handle this and how the financial implications in my life. And so this preoccupation can kind of bother and kind of disrupt our day-to-day cognitive functioning. And so even without the medication, just by reducing the anxiety and the stress, that within itself can potentially kind of clear up our minds a little bit. So there's multiple avenues through which that can help. And again, it's not going to help for everyone, and it's not a magic cure, and it's not clear cut. But there is, growing evidence indicating that it can help.
And well worth a try. Thank you so much, Dr. Greenberg, for joining us this weekend. And for more information, you can contact the FPA if you want to get in touch with Dr. Greenberg and his team. And thank you again.
Absolutely. Thank you so much. Pleasure being here.